talk about the top 10 reasons to get a dental implant. So I'm here with Dr. Peter Yoo from The Tooth Doctor, and he's going to give us a lot of great information on this one. I'm going to share a quote with you.
Okay.
It is from David Brinkley, and he says, "A successful man is one who can lay a firm foundation with the bricks others have thrown at him." It's a good one.
That's very
So a study and a study survey published by Acta Odontologica Scandinavica looked at patient satisfaction rates 8 to 14 years after undergoing implant dentistry treatment. Of the respondents, 81% reported high levels of comfort while biting and chewing, and 94% of respondents reported high levels of satisfaction with their smile aesthetics even many years later. That's good news.
That's very good.
Great solutions. So can you think of a story or something about implants that stands out in your mind?
You know, one story that comes to mind is I went to my mentor's dental clinic, and he's taught me a lot about implants and dental care and just treating people like people.
Yeah.
We had this one patient had full upper lower dentures. Okay? And a lot of times when you get dentures, at an earlier age, dentures actually create a negative effect on the bone, which means it causes the bone to shrink faster. Okay. Getting to the point, case in point, their lower jaw, the bone was gone, like flat. And so they had a denture in that basically wobbled around, like you kind of have to use your cheeks and your tongue to kind of hold it in place. Okay? And she was just done. It's just frustrating and wanted implants. So I came in that day, and implants had already been put in, and so they were basically placing little locators or little tabs to connect the denture to the implants. Okay, so her denture is wobbling around, comes in, and basically puts these locators on, and then puts the denture on the locators on the implants, and waiting for it to set. He said, "Okay, I'm going to be gone. I'm going to go see a patient, and in about 10 minutes, when you hear a beep, try and take it off." Okay. So he left, I left, came back. I just went to say hi and see how things are going. And the lady, after the beep, she was spending probably about 10 minutes trying to get this denture off. Okay. The saying goes, literally night and day. Okay.
Yeah.
Denture that wobbles around all over, like she can go, and her denture would fall out of her face. Now to the point where she can't even get denture off. Now, don't get all scared and worried like, oh my goodness, if I get implants, I won't be able to take my dentures out. We made sure that it clicked on and off properly so that it was, it had just needed a good little snug pressure and it would pop out nicely.
Okay.
But once you click it in, it stayed put.
Wow. Okay, so we're going to go through 10 reasons here why you would want to get a dental implant. So number one reason is dental implants look more natural than dentures.
I agree. I think that implants, when you get a good lab, that places, I've gone to many courses, and you see these specialists showing their teeth, and they'll show you a big smile and go, which one is an implant? Everybody's like, oh, that one. And so it's very, very hard to find the difference.
To see it. Okay, good. Okay, reason number two, improved confidence when eating and interacting with others.
I think that, when you have a denture, or even sometimes a bridge, over time, it can affect the aesthetics. With denture, they become loose. I've heard of patients where they're talking to someone and their denture falls out. Actually, that brings to mind about my grandmother. She, on her 90th birthday, she was trying to blow out candles. And so she's trying to blow it out, and she just didn't have the lung pressure, and the candles wouldn't blow out. So she blew harder, candles wouldn't blow out. So finally she's like, oh my goodness. So she, big blow, and her denture popped out. Somebody got a perfect snapshot. So very funny, but at the same time, just realizing that it's, when you have a loose denture or something, it does affect how you want to talk and interact with people. Yeah.
For sure. So, brings me to reason number three, more comfort and convenience.
Once you place an implant in, most times it's good. It's solid. You know, getting it checked. On one of my previous videos, we talked about how you want to take care of the implant. But on the most part, once the implant is good and solid, it doesn't, you know, it's like your teeth. You just live with it.
Yeah.
Whereas, you know, with a bridge, it's hard to clean. Dentures, you know, you have to get them checked and maintained each year. I do see a number of people where they get a denture and they don't go in for like 4 or 5 years. Well, in that time, the bone has changed and the denture is not as solid as it used to be. It's worn down. So having the comfort and convenience and just being able to eat. So,
yeah. So reason number 4, eating food is more enjoyable.
Yes. There are studies that say, you know, when somebody has a full upper denture, whether it be top or bottom, their bite pressure actually decreases to about 20%. So they lose 80% of their biting power.
Really?
Yeah. So eating certain foods becomes a lot more difficult. You know, people do, but again, just the enjoyment of eating and just kind of feeling, you know, the textures and all that stuff. You know, we watch, you know, Chef's Table or, you know, Mr. Ramsay, right? And everybody sees all these different types of foods and stuff like that, and all of it is just the flavors, the texture,
The whole experience.
Mm-hmm.
Reason number 5, your sense of taste is not hindered by a denture covering your palate.
Yes.
So.
Your tongue does most of your tasting. People know that.
Yeah.
But your palate, the roof of your mouth, also does tasting. Okay. And even your sense of smell. You know, when you smell something and then you eat it, you get the full aroma, and that enriches the taste of certain foods.
Yeah. Okay. Number 6, better diet and health. So I guess that kind of relates to being able to eat things like apples instead of something.
Some
not
people,
as
they just don't want to eat certain foods or eat their vegetables and greens, stuff like that. So, you know, raw vegetables are very important for a good balanced diet. I don't know anybody that says not eating vegetables is fine, but yeah, kids might say that anyways. So, you know, just your overall health, you know, being able to eat and enjoy foods and just having a solid bite, you know, even just chewing food properly and getting it down so that it can, you know, be broken down and digested is very important.
Right. Reason number 7, the durability.
Durability, yes. Again, you know, I do tell my patients, you know, if you're young and in your 20s, I'm like, hands down, you should get an implant, because the durability in an implant, like your natural teeth, my belief is that, you know, if you're 20 years old and you live till you're 80, okay,
It's a long time.
right? That's 60 years.
Yeah.
If you have an implant when you're in your early 20s, my belief is that that implant most likely will be with you. If you're taking care of it, it will be with you pretty close to the rest of your life. Okay, let's say you chip the crown or something, you got to replace it. Overall, cost-wise, if you get a denture and you have to change it every 5-10 years, so cost-wise, in the end, your denture will cost more. Cost-wise for a bridge, you know, bridges on average, they say last about 20 years. So if you're 60 years, you're gonna have 3 bridges. You're gonna actually, you know, pay more in the end.
Yeah.
Yeah. So durability-wise, implants are very good, very solid. Okay.
Reason number 8, better speech.
Well, that's in relation to, you know, when you have something in your mouth. I'm gonna relate to glasses. I used to wear glasses. I got laser eye surgery, and so, you know, glasses are great. You know, they're helpful. They're beneficial in various ways. But the saying goes, trying to do things au naturel.
Yeah.
Okay, so if you have your natural, you know, teeth and eyes and eyelashes, sorry ladies, but you know, when you have things that are natural, it's a lot easier. There's less time and maintenance that go with that. So
yeah, and just being in the way. Right?
So just being able to speak better. You know, when you have a tooth that feels like a tooth.
Yeah.
You know, I know some people where they have a bridge and I don't know what's happened, but when they start talking, they hear like a whistle.
Oh.
So various things that can happen. And again, with dentures, you know, as much as they look nice and a lot of people have to get them, it can affect how you say certain words. So.
Yeah, right. And reason number 9, implants don't fall out.
on the most part. Again, an implant is supported by the bone, so if you're keeping the bone healthy, coming in for your routine, cleanings and maintenance, it's like a car. You don't just drive a car for like 5-10 years. You have to go in every so many months to get the oil change, check and make sure that the seat belts and the timing belts are all working properly. So you car guys out there, you understand, if you take care of your car, it's going to last for many years. You see all these classic cars from the 60s, 70s, those people that took care of them, that's why they run really well today. And so again, implants, they're not going to fall out if you maintain them, and again, they're like natural teeth. It's just easier to clean. That's why they're more maintained.
Yeah, and you come in and get them checked often at the tooth doctor. Reason number 10, bone development for implants.
Yeah, so this is a little bit more in depth for people out there, that basically your bone around the teeth are actually supported and stay thick because of your teeth. When you eat certain foods, that pressure is actually stimulating the bone to stay nice and thick.
Yeah.
Okay. When you have an implant, when you're biting on the implant, same thing. It creates that stimulation of the bone to keep it nice and thick. Let's say you get a bridge, and so now you have a space where there's no tooth, things like that. There's no stimulation of the bone, and so bone will tend to shrink.
Oh, okay.
And so when you have a tooth and there's bone here, well, what can happen over time is as the bone shrinks away, what happens to the tooth? Now you see that the root is being exposed, and that's where you get more risk of sensitivity, cavities on the roots, other issues like that. Yeah.
Okay, thanks for breaking down those top 10 reasons to get a dental implant. Thanks for joining us here at the Tooth Doctor on YouTube, and don't forget to subscribe to the channel, give us a like, a thumbs up, and we'll see you on the next one. Bye.
Bye.